Welcome to the Free Marketeers, the official podcast of the Free Market Foundation. Hello, listeners, and welcome to another episode of the Free Marketeers podcast. I am Martin van Staden, and as always, I am joined by Mpiyakhe Dhlamini and Chris and Mpiyakhe here at the Free Market Foundation. So I thought we would start this episode by talking a bit about Mpiyakhe and Chris's event that they attended. I think it was this past Tuesday in Pretoria, invited there by a student organization to, I think, debate capitalism versus socialism or something like that. Chris, can you give us an outline of how the proceedings transpired?
Yeah, so it was near the University of Pretoria. I think, plus minus 50 people in the crowd. Maybe Mpiyakhe can correct me there, because as we know, he sees numbers and digits everywhere. He sees the matrix.
Oh, that's a myth. I show you that's a myth. Only in my dreams.
So a good crowd, good turnout. Obviously, mostly students, a few older people, a few people from, I don't think necessarily a university background. But yeah, the basic premise was capitalism versus socialism. We tried to present the best aspects, the best sort of arguments for capitalism in South Africa specifically. And our opponent, a representative from the EFF, his name was Marcus. He presented his possible best case for socialism in South Africa. He had a few supporters in the crowd, and they also delivered questions and stuff in the question and answer session. I thought it was very well run. The moderator, John Williams, he's a professor at Rhodes University. He was good in asking his questions. He gave us all ample time to talk. We sort of went first, then Marcus, and then he sort of asked us different questions: how capitalism would handle this sort of issue, how socialism would handle that type of issue, stuff like inequality, exploitation, these concerns. And then they opened up to the crowd to ask their questions. There was a whole wide range. There was stuff on economics, stuff on price inflation and exchange controls, for which I was very happy that Mpiyakhe was there, because I was panicking there. And then obviously stuff on like morality and that kind of thing, on both systems. So overall, a very good event. I'm hoping we can continue the partnership. I think we all three of us came into the sort of debate in good faith, and it was handled well. So that was my sort of perspective on it.
Yeah, and Mpiyakhe, do you have any highlights from the debate? A point that someone brought up, or a point that you made, and then they maybe countered in an intelligent way, or something like that?
And unfortunately, it's just a pity that none of this was recorded. But I think both sides made very good points. Towards the end, like we got some flack for not for things that we may have forgotten to include by one of the questioners in the audience. So that was also interesting. So I think it was just making the normal arguments for capitalism, why we see it as being superior. I mean, I think the evidence is massively on our side if you have seen the history of how things have gone in the world. So we made those points, and also there was even a question on the not really a question, but a comment on which aligns more with Christianity, between capitalism and socialism. So that was also just, the entire evening was interesting, and I was glad that our opponent in the debate was very respectful, very evidence-based, and willing to concede when when the evidence was against him. So I was impressed with that, and I was it was just a good conversation, and I hope we get to have more of these conversations with people who we might not necessarily agree with right now.
Yeah, absolutely. No, it sounds like it was a great success, and I definitely look forward to the next one with Ratio Christi, the group that invited the FMF to participate. They seem very keen on creating a national discourse and ideas that isn't necessarily happening in other forums. So yeah, if they're going to be the medium for that, I encourage them to carry on and definitely involve us. Now, just staying with Mpiyakhe here for a moment, he wrote an article in today's City Press about property rights, specifically in rural areas, and I found that quite interesting. Makes a good data-based case as always. So Mpiyakhe, if you would give us a executive summary of what you were getting at in your article, and then we can discuss that.
Okay, so since you guys are executives here at FMF,
Oh, wow. Okay.
project manager and head of legal policy, I'm sitting in rarefied company. So the article was basically making the point that if you look at the places which have communal land in South Africa, those are also the poorest areas of the country. I mean, for example, the provinces which have the greatest amount of communal land in South Africa also have a negative net migration, which means people are leaving those provinces. And the provinces which have positive net migration are the provinces which have the most secure property rights, which don't have communal land, like Gauteng, Western Cape. And then also, if you look at the mere fact that the 43% of South Africa's poor people live on communal land. I mean, the case for titling, it sort of makes itself. You can't be clearer than that. And I think the last point that I made was that these poor provinces, because of how government believes in equitable sharing of resources when they allocate budgets, these provinces with the most communal land and the most poor people, they receive most of the government budgets, and that people are still living. So it shows you that it's not government spending that's going to solve the problem. It's not trying to do more welfare and things like that. You just need to solve the problem of property rights and give people title deeds. And then, of course, you'll have to solve other problems like deregulating labor markets, but those are shared across the country. It seems like the one thing that is unique about these places is the lack of property rights. And once you solve that, you will solve a large part of the problem.
Yeah, it's interesting. Many politicians bring up the idea of special economic zones a lot, and then relaxing labor regulations and stuff like that in those areas, which we're obviously in favor of. But I wish they would also propose special, I don't know, land property zones in the country and look at where this growth is very low, kind of thing, and why people are moving to different provinces, and in those areas, make the title deed process 3 steps if it could be simplified that much, and bring the costs down by X amount.
So now that you mentioned that, I just wanted to mention one last point. It's not in the article, but one of the things when I was doing my previous article on Rwanda, one of the things when I was doing my research was that Rwanda decided to title 11 million pieces of land between 2009 and 2013, which led to a lot of economic benefits. And now in Rwanda, if you want to go invest in Rwanda, you can go online, go to a website, search all the pieces of land, see who owns this piece of land, and then it's as easy as that. They've completely automated their entire land registration system.
Jeez.
And it has led to a lot of benefits. After they started titling all of this land between 2011 and 2013, government revenues from land, like property taxes, grew by 5 times. Like, so that's there are a lot of opportunities if the countries that have seen that the importance of property rights tend to prosper.
Yeah.
I don't know if you know any of the details in Mpiyakhe, but like people may come at us and say, but we have something called sectional title in urban areas, like you live in an apartment block, and some people own parts of it, but no one is really the owner of it all, and they may say that is basically communal, because there are communal facilities and so forth. So I don't know if you know, but what characterizes communal property that makes that leads to people actually mostly being poor on that property?
Yeah. So in communal property, I think a sectional title deed is something that you can trade with. So you can sell it, and you can and the new owner can have as secure a claim as any other title deed over that property. Of course, there will be regulations set by the society in that. But in communal land, the difference there is that you can't you can't trade it. Because the nominal owner of all that land is still the king of the Zulus, or through the Ingonyama Trust. So, or rather, the nominal owner is the minister. In fact, the trustee is the king through the Ingonyama Trust. And so that's so you can't really sell or trade that land because there's no title to it. Now, what the interesting thing is, if you have a permission to occupy, it can potentially be converted to a title deed, but that will require first of all people having the political will to do this, because it costs some money, as the FMF knows from the Kailam project. So
Yeah. Hey, any more words on this, Chris?
Yeah, I was just gonna say, with EWC, that I mean, that would lead to the whole of South Africa being effectively sort of communal land, and then just whatever minister is minister of land, or whatever department it might be called. I don't know, the Uber minister of this or that kind of thing, of minerals kind of thing. So then, I mean, to think that something that isn't working in one province, if we make it countrywide, will then work, would be very, very counterintuitive to me. So I think it's that same sort of principle. If it's not owned by the individual, then it's not going to result in any. It's not going to produce any results, any benefit for anyone.
Yeah, no, and it's just on the point on poverty. I forgot to mention one more stats on Rwanda. It's after they started titling all of this land, like the proportion of people who are food insecure fell from 85% to 65%. So that was it shows like it. I mean, the case is quite clear.
Yeah.
You need property rights to deal with poverty. Without property rights, you will not deal with poverty. It's just as simple as that.
Yeah, it's a shame that politicians keep rejecting this, even though we see this in these economic freedom indices by Heritage, Cato, Fraser. All of them show that countries who have higher scores in protecting property rights inevitably have higher levels of human development, prosperity, etc. Yeah, I mean, that's probably one of the reasons why I think a lot of politicians are in fact malicious rather than just stupid, because all the evidence is at their fingertips and says, listen, property rights equals, in most cases, all else being equal, prosperity, and they tend to ignore that. But yeah, hopefully the FMF in South Africa can maybe sway a few of the non-malicious politicians in this direction. For example, we'll be doing a audit of economic freedom here at the Free Market Foundation very soon, with speakers all around the world coming to talk about the various areas in the Economic Freedom of the World Index by the Fraser Institute, and to say where South Africa is falling behind and where it can improve. And I'm pretty sure that when it comes to property rights, the point will be made that we're going in the wrong direction, and that if we just reverse that, then we will see more prosperity and more economic growth.
This might be a bit of a spoiler alert, so listeners, just maybe skip the next like 5 seconds if you don't want to know. But South Africa is falling in pretty much all the the areas of the EFW,
Yeah.
so
Yeah.
and that obviously indicates we're going very much in the wrong direction in terms of policy.
Yeah, no, that's.
But I'm sure that's breaking news to all of you. So.
Yeah, no, I think all of our listeners probably know this, but like another instance of this, which I'm sure is being factored in, is the national health insurance policy that the government is currently very keen on. It was announced, I think, yesterday or the day before that cabinet has approved the national health insurance bill, and it's quite unclear right now what that bill actually says, because the public participation process for that bill ended in October of last year, 2018. And we have been told, at least, that many substantial and material changes have been made to the bill, which were basically the diktat or opinion of some bureaucrat or health wonk, rather than actually from the public saying that this needs to be added or whatever. Because the point that the FMF made in our submissions and our other organizations like the IRR is very simple. We cannot afford this, and if you try and implement it, you'll destroy the private healthcare sector, and everyone will be worse off for it, including but especially the poor, which will now have no chance to upgrade their health standards anymore, and the rich will probably just leave as they already are. So yeah, that is the currently on the agenda. So we're not quite clear on what the new bill says. They said that the new Minister of Health will go into the details at a press conference at some undetermined date in the future. But I think it's probably fair to assume at this stage that it's still going to be way too expensive. The numbers that I've seen vary wildly. The most recent one is that it's going to cost us 183 billion rand, but I've also seen numbers into the 400 billion rand. And I mean, the point that is constantly being made is that the Department of Health has not run a cost-benefit analysis to determine actually how much this is going to cost. They're just saying, well, we're going to do it. Don't worry about the cost. We'll figure it out when we get there. And that is deeply concerning, because one of the things that was announced when they talked about the bill being approved by cabinet was that the so-called social solidarity principle was now becoming part of the NHI. I'm not sure how that will manifest, but the social solidarity principle has already been part of the medical schemes regime in South Africa. And this basically, now I'm going to summarize it and oversimplify it probably, basically means that younger, healthier people are expected to pay for older and mostly more ill people. and that medical schemes cannot discriminate based on age, and for example, or on previous illnesses, and for example, tell an older person you need to pay a bit more. So the result of that has been, and absolutely will be under NHI, is that younger, more healthy people who do not now need health cover necessarily, this is something that mostly comes about later in life, are gonna say, well, you're expecting me to foot the bill for sick other people who themselves are not paying a fair share, so I'm just not gonna use it. So what's the result is gonna be, we're gonna have younger people without cover, and the result will also be that we'll have older, more sicklier people without cover, because the medical schemes will collapse without the younger people paying in. So yeah, it's a vicious cycle. I don't know, Chris, you've definitely had some words about the NHI in the past. Do you have any new thoughts on this?
Yeah, so on the social solidarity idea, it's a nice and nebulous concept. So any politician can twist it to into the details that they want. They can justify it any way. It can mean, as you said, caring now for older people, that sort of thing. It's always couched in very nice moral language about caring and concern and that sort of thing. But at the end of the day, someone has to pay for it. So if you think about healthcare, it's all, whether it's the equipment or the doctors or the nurses, it's all a service and someone has to provide it. So now that we've accepted the right to healthcare, we in effect accept that you have a right to what someone else produces, and the government's not going to stop in implementing stuff like the NHI to give people now what they say they have a right to. I just going on past history and experience, on the green paper on the low cost benefit options and the white paper on the NHI, the Department of Health didn't indicate any concern for the public consultation process. So they've gone ahead, pretty much ignored a lot of what has been said at any of these events, summits, this sort of thing. They just run now with their ideological goal. So regardless of the cost, they seem to think the money will come from somewhere, or surely if they keep repeating these moral phrases, the private sector will just eventually accept it and somehow make the money appear out of nowhere. So no, to me, there's no precedent to assume that that the bill as it was approved now by cabinet incorporates anything that the public organizations and bodies have said. So I think we should definitely keep an eye out for that as closely as we can. But obviously, I think the DA specifically, they said they came out, I think half an hour after this was made public, and said how bad an idea this is. So I'm hoping that they'll continue to apply the pressure as much as they can. And the other parties, no matter their ideology, they should maybe realize at some point that there's no money for it. If we think ESCOM is bad, NHI will be even worse.
Oh yeah.
And all these things feed on each other. So once one of them folds, the rest of them, because they're all interlinked, because they're backed by the government. So again, this problem of, if the government is your sole healthcare provider or seller, if you want to put it in their language, if they fold, it affects the whole country. If I get my health coverage from Discovery and Discovery folds, it only affects Discovery members, not the whole of the country, which is the great thing about competition in healthcare. So that's just my few thoughts on this thing. I'm obviously against socialized medicine in principle, but also in implementation. I simply don't think it's viable. We don't in the first place, we don't have a strongly growing enough economy to fund that kind of thing. So simply from a practical point of view, you can be a very ardent advocate for socialized healthcare, that you think everyone has a right to it, that they should have it. But in South Africa, as it is right now, there's no fiscal room for it.
Yeah, I think last year at least, the presumption that of funding that was made by government was that everyone currently paying money into private medical schemes and private insurance will almost one-to-one move over to NHI and pay all of that money into the NHI, and therefore that will cover the funding. Now, this is obviously totally nonsense. When your Discovery premium cover gets expropriated, you're not just going to say, oh, well, that's fine, I'll just give this to the government now. You're obviously going to keep that money.
No.
And as a result, the bulk of funding, if not all of the funding for the NHI, are going to come from taxes. So either government has to raise taxes, which I'm pretty sure they won't have any problem doing, even though we are so way past the Laffer curve. We're so totally way past that it's not going to make any more money by raising taxes. Or it has to divert expenditure from elsewhere, reduce social grants, downsize what little of a military we have left, stuff like that. So
And
yeah.
military's busy in Cape Town, so they'll
Oh
be
yes,
busy for a while.
yeah, where they've invaded the mother city, but yeah. So the point is the whole thinking around funding this is totally nonsense, based in the most ridiculous assumption that people will just continue paying what they're currently paying for their private medical schemes to a state-owned corporation. I mean, we don't give the amount of money we give for DSTV to the SABC.
Yeah.
You'd have to hold a gun to South Africans' heads before they will do such a totally ridiculous thing. So yeah, Mpiyakhe, what are your thoughts on this ridiculous intervention?
So I'm just going to repeat the public choice point that I've made before. That, you know, the assumption here is that okay, there are two scenarios. Either the NHI will be a good quality alternative to what we have now, which is very unlikely, or it will be a very bad alternative, like the public health sector is already.
Right.
So the quality will be as bad as the public sector. So out of those two options, the first option, if it's better than what we have already, or as good as the private sector that we have now, demand is simply going to increase, because people will want to use more and more of this. Like even if before you would have decided to stay at home and not go get that teeth problem that you have fixed or whatever. Then now, because it's free at the point of use, then you say, oh, let me go. Why not? Because the quality is good. So,
Yes.
and then if the quality is bad, then obviously then the users of the system appreciate this in the same way that the users of the public healthcare sector appreciate this through bad quality. I mean, you can have maggots in your mouth apparently in the public healthcare sector. And so all of those things. So in no way does this seem that I don't see how this can conceivably be a good idea, because it will end up taking the entire economy. Because if in the situation where in demand increases, then the more taxes will be required to meet that demand. And who's going to be willing to pay those? People will just leave as though they're already living, already going to other places, other countries. And then on the other hand, if the quality is bad, they leave anyway, because they can't get access to quality healthcare. And we need those people to grow the economy. And on your point about social solidarity, are we really hoping that young people will be able to fund this when we have 55% youth unemployment? I mean, surely we need young people to get jobs first before they can fund older people. So it's ridiculous across multiple levels.
Yeah, the funny thing is, the two internationally renowned examples of universal healthcare systems, Canada and the UK, as I understand it, they're actually trying to fix these systems that have basically started to collapse because of various of the reasons that we've mentioned, but they're characterized by long waiting times. I think price control, so that has led to Canadian doctors basically fleeing the Canadian healthcare system to go work in the United States. And yeah, Ireland, something I didn't really know before I read through our submission on NHI. Ireland recently, I think in 2015, they considered adopting universal healthcare, but they said they can't afford it. Now, this is a country with, I don't know how many times the gross domestic product per capita that we have. And they said, my goodness, we can't afford it. And they probably have a far smaller population and healthier population than we have. They said, we cannot afford it. And our government is saying, we don't know if we can afford it, but we don't care. We're going to try it anyway. That is totally ridiculous. And I think the point should be made, because this is going to be the question on everyone's lips. What about the poor? The government says that only 16% of South Africans have access to quality healthcare. Now, I'm glad at least that government is admitting that their own healthcare system is totally shit, and that the private sector is far more superior. But the point is, government can. There are various things that government can do. The number one thing that we as free marketeers will say is government must do nothing, and as terrible as that may sound, that will, with time, and not necessarily a lot of time, will lead to economic growth, will lead to poor people having far more money in their pockets to spend on private healthcare, definitely lead to poor people having jobs to pay for healthcare. That is obviously the free marketeer's number one option. The second option is what the FMF has repeated to government multiple times, and that is that it must abandon the notion of universal healthcare and not pay for everyone's healthcare, but rather issue healthcare vouchers to those among us who absolutely cannot afford any healthcare.
Yeah.
And that means you leave the private sector alone. You don't induce more regulations or price controls or social solidarity principles and all these funny actuarial things that are going to just bring the whole system down. Just say if you earn below a certain amount of money, you get X amount in a healthcare voucher every month or every year that you can spend on healthcare at a private healthcare provider. That is the moderate and probably implementable alternative that government definitely should look at if it truly cares about the poor, rather than just this ideological goal of nationalizing healthcare. So there is a measure, an available intervention to cover the poor who cannot afford healthcare without destroying the best healthcare system in Africa, private healthcare system in Africa. So there does exist that alternative, but government is totally ignoring it.
And as you were making your points, Martin, I just remembered one stats I read about poor people from States SA. It showed that 2.5% of people who are under the food poverty line still choose to use private healthcare. And so if you just think about it, these people can barely afford food, but they are sacrificing money they could be spending on food to escape away from a public healthcare sector that is dysfunctional. So that should tell you that, you know, the poor want private healthcare as much as anyone.
Yeah. Yeah, and I mean the fact that it's so low, and I mean we can contrast that with private schools, which increasingly the poor are making use of totally private schools. Why not in healthcare? Well, I think that is because the healthcare sector is far more regulated already than the private school sector. For example, the National Health Act basically tells private hospital groups that if a certain area already has a hospital, you're not allowed to build another hospital there. Or if an area already has X amount of hospital beds, you're not allowed to add more beds to your hospital. And it's ridiculous, like micromanaging stuff like that. That obviously means that our private healthcare sector is very much an oligopoly. I don't know how to pronounce that,
No,
but we
yeah.
have a small number of private health groups, and I wouldn't be surprised if that gets reduced to two or maybe only one, maybe a Johannesburg, Sandton-based healthcare group, which will then dominate the market if we implement more regulations. So
that's interesting to hear, Martin, because restricting supply in that way artificially is going to raise prices, definitely. And the other thing that they do is this minimum benefits that every medical aid has to include. And that obviously raises costs because you have to cover things that you will never ever use. Like, for example, men have to pay for reproductive services that only women will ever use. So
you don't have a custom package that's suited to you as an individual. You have all these, I think they call them primary medical benefits package that is like 250 diseases and conditions that you're covered for. Like it's ridiculous, and of course that pushes the price up. So don't be surprised that so few poor people are using it. So I mean the NHI is definitely not going to help us on our economic freedom of the world index, and if anything it's probably going to push us down several rankings in and of itself. And geez, we've been pretty high in Africa, but now that the best private healthcare system in Africa is going to be totally destroyed, I don't know if that's gonna be the case anymore. But so we've done our bit of depressing you for this week. I don't know if either of you have anything more to say.
Nothing uplifting, unfortunately. In the sport, Bafana were knocked out. The Proteas were knocked out a while ago. So unfortunately for South Africans, they can't look at the sport at the moment. But the World Cup is coming up, so hopefully the Springboks will do a bit better.
So
don't focus on economics and politics. I can say that much.
I just want to encourage the Springboks to get their annual checkups with their doctors before the NHI gets implemented. But
So I just wanted to end with a quote from the deputy chairperson of the Rwanda Development Board. We know that Rwanda is a bad place in terms of civil rights and all of those things, and it's still an open question whether their economic reforms can survive. But one of the striking things when I was reading about them, like this quote where the deputy chairperson says that Rwanda has the goal of becoming a private sector-led economy. I mean, because they recognize that the market is the best way to get prosperity. It's not because these people are philosophically liberal or libertarian. They just recognize that it's the best way to do things. Yeah.
But even on that, sorry, you asked for our last points, and now we keep going. At the debate, it was brought up that some of us, what we were talking about, it's very, these Western ideas, and we should be talking about South Africa and stuff. This is the point that we also tried to make there. These things aren't the privilege of Caucasian Europeans and Americans. Individual liberty and economic growth is the right of all the people of the world, as long as government can get out of the way.
Yeah.
Which I think is great in the case of Rwanda. Obviously, we hope that they reform some other things.
Yeah.
Some police state kind of tendencies, but we'll see.
Yeah, no, I think that's a good note to end on. So please remember to subscribe to our YouTube channel. It's the big red button right under this video. Follow us on Twitter at FMF South Africa, one word. Follow us on or like us on Facebook. That is Free Market Foundation South Africa, or facebook.com/FMFSA. And remember to check our website at www.freemarketfoundation.com. Cheers and have a good weekend.